Imagine a home that does more than shelter you. It actively helps extend your healthy years. This project treats longevity as a coordinated ecosystem where medicine, food, sleep, air, light, AI, and regeneration work together around daily life. We've moved from autonomous intelligence through spatial human experience into biological health systems. Cognitive twins, immersive environments, health twins, immune foundries, local pharmacies, and microbiome engines now begin to converge. Project 15 asks a single question: how can a living environment continuously support longer, healthier, more adaptive lives? Think of the longevity habitat as a health operating system for daily life. Instead of separating care into occasional appointments, it connects the home, clinic, food, diagnostics, AI monitoring, regenerative therapies, and cognitive support into one coordinated environment. The goal is Healthspan, not just lifespan, preserving function, mobility, cognition, and resilience for as long as possible. The habitat watches for small biological drift, adapts routines early, and helps prevent decline before it becomes visible. Health becomes embedded in the environment itself. This changes the center of gravity in healthcare, from treating disease after it appears to shaping the conditions that keep biology stable. Much of aging risk is influenced by repeated daily exposures: how we sleep, move, eat, breathe, handle stress, receive light, avoid toxins, and stay socially connected. A hospital visit captures a moment. A longevity habitat works continuously, detecting small deviations and making healthier choices easier by design. By 2030 to 2050, Healthspan infrastructure moves closer to daily life, turning homes, neighborhoods, and routines into prevention systems. The longevity habitat is best understood as a layered system, not a collection of gadgets. First, the sensing layer captures signals from the body, the home, and the environment. Those signals feed a health intelligence layer, where diagnostics, biomarkers, digital twins, and AI agents turn raw data into risk forecasts and recommendations. The intervention layer then adjusts daily life: nutrition, lighting, sleep, air quality, movement, and cognitive support. Finally, the regeneration layer connects the habitat to deeper biological services, from immune modulation to cellular therapies. The core idea is closed-loop health: measure, interpret, intervene, and regenerate. The habitat's first job is to listen carefully. It gathers signals from the body, including sleep, heart rhythm, glucose, movement, breathing, and stress. It also watches the environment: light, air, noise, humidity, and allergens. By blending simple check-ins with passive sensing, it reduces effort for the resident while building a living health record that supports earlier detection and more personal guidance. An environmental digital twin is a living model of the home, constantly updated by sensors and behavior patterns. It learns how airflow, light, sound, occupancy, temperature, and air quality interact with the body. That makes health patterns easier to interpret. Poor sleep may follow evening blue light. Inflammation may track with ventilation or contaminants. The main benefit is prediction. Before changing a room, schedule, filter, or lighting plan, the system can simulate likely outcomes and recommend the safest improvement. The home becomes measurable, testable, and continuously optimizable for health. At this point, the AI agent becomes the coordination layer for longevity. It interprets signals from wearables, home sensors, diagnostic tests, and a personal health digital twin. Rather than waiting for disease to appear, it looks for subtle patterns of drift: sleep changes, inflammation markers, nutrition gaps, or recovery delays. From there, it recommends modest daily adjustments. When needed, it routes information to clinicians, pharmacies, nutrition services, or regenerative care teams. This is not a generic wellness chatbot. It is a navigator connecting everyday behavior with medical-grade prevention. Nutrition also becomes a feedback system. First, the habitat measures biology: glucose patterns, inflammation signals, nutrient status, sleep, activity, and gut diversity. Then microbiome and metabolic intelligence interpret what those signals mean for this person right now. Food options are matched against local availability, climate conditions, supplements, personalized kitchen capacity, and precision fermentation inputs. Meals are prepared or adjusted accordingly. After eating, response data flows back into the system, refining the next recommendation. The diet is never fixed. It behaves like an adaptive therapeutic layer for longevity. Recovery is not something that happens only after exercise or illness. It is a daily system anchored by sleep and circadian timing. Morning light helps set alertness, mood, and hormone rhythm. Evening dimming signals the body to prepare for sleep. During the night, the habitat can tune temperature, humidity, sound, and air quality to protect deep sleep. Just as important, it learns from disruption. Poor sleep may point to stress, diet, infection, environmental discomfort, or cognitive overload. In a longevity habitat, sleep becomes measurable infrastructure, turning recovery into a core biological maintenance process. Environmental quality is one of the most overlooked drivers of health span. A smart habitat treats air, surfaces, water, light, noise, microbes, and materials as measurable exposures, not background conditions. It tracks particles, VOCs, CO2s, humidity, mold, allergens, pathogens, and chemical residues. Then it responds with ventilation, filtration, purification, humidity control, and safer material choices. The goal is to reduce hidden biological stress before it becomes fatigue, inflammation, poor sleep, respiratory strain, or cognitive drag. In precision longevity, the indoor environment becomes an active health system. The habitat is not meant to become a hospital or a biotech lab. Its role is to act as an access layer. Daily signals and digital twin forecasts reveal when the body may need repair, not just routine support. Those signals move to an AI health agent, then to clinical review, where consent, evidence, and risk are checked. When appropriate, residents can be connected to regenerative services, tissue repair, senolytics, immune rejuvenation, cellular therapies, or custom biologics. Afterward, the habitat continues monitoring recovery. The guiding principle is orchestration. Advanced interventions remain clinically governed, while the living environment helps identify the right moment. By 2050, longevity design may move beyond the smart home and into the neighborhood itself. Homes, clinics, farms, parks, transit, air systems, and social spaces can work as one coordinated health span network. The goal is not just convenience, it is daily prevention. Cleaner walking routes, safer mobility, better sunlight exposure, lower pollution, faster emergency response, and more reasons to connect with other people. Shared community data can reveal health patterns, while privacy protections keep individuals from becoming the product. In this model, longevity becomes civic infrastructure. By 2050, longevity may stop being a medical category and become a civilization layer. Care shifts from occasional intervention to continuous biological stewardship, embedded in homes, food, workplaces, insurance, and city design. The useful mental model is convergence. Each industry keeps its core function, but also becomes responsible for measurable health span outcomes: resilience, cognition, recovery, mobility, and aging risk. For founders, the opportunity is not just another clinic or wellness app. It is building the platforms, standards, services, and networks that make longevity environments scalable, trusted, and equitable across populations. Module 3's final idea is that longevity becomes powerful when it is coordinated. Sensors, AI agents, digital twins, nutrition, sleep, air quality, diagnostics, and regenerative medicine work together to act before decline accelerates. That creates new models for neighborhoods, real estate, and care networks. Next, we widen the lens to autonomous physical systems, starting with disaster response swarms.